Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, contraindications of liver transplantation. In the contraindications of liver transplantation, we have two types of contraindications, which are absolute contraindications, and we also have relative contraindications. First, absolute contraindications of liver transplantation. Absolute contraindications are if there is uncontrolled extrahepatic biliary infection. Already, if there is uncontrolled extrahepatobiliary infection, so there is infection which is activating cytokines and inflammation in the liver. So, if you do a liver transplantation in such case, so this infection might even spread into the graft which is transplanted, and this can even result in rejection very easily. If the patient has active and untreated sepsis, then we do not do liver transplantation. If there is uncorrected life limiting congenital anomalies, if there is active substance or alcoholic abuse by the patient, if the patient has advanced cardiopulmonary disease, or if the patient has any extra hepatobiliary malignancy which is not including the non-melanoma skin cancer, if there is metastatic malignancy to the liver, or if the patient has cholangiocarcinoma or AIDS, or if the patient has life threatening systemic diseases, then we do not do liver transplantation. Then if you see the relative indications of liver transplantation, we also have relative indications of liver transplantation. The relative indications include if the patient's age is more than 70 years. If the patient's age is more than 70 years, or if there is any prior hepatobiliary surgery is done to the patient, or if the patient has any portal vein thrombosis, or if the patient has any renal failure which is not attributing to the liver disease, if the patient has previous extrahepatic malignancy, or if the patient has any if the patient is severe obese patient, or if the patient has severe malnutrition and severe wasting with medical non-compliance, if the patient is HIV seropositivity is seen with failure to control HIV viremia or CD4 count less than 100 per microliter, if the patient has intrahepatic sepsis, or if there is severe hypoxemia which is secondary to right to left intrahepatic shunts, like partial pressure of oxygen is less than 50 millimeters of Hg, if the patient has severe pulmonary hypertension, mean arterial pressure being more than 35 millimeters of Hg, if the patient has uncontrolled psychiatric disorders. So all these are relative contraindications of liver transplantation.
thank you and thank you for watching.